Hi, good afternoon, everybody, and welcome to our latest masterclass all about data standards and why standards matter. We'll get started in a couple of minutes, just going to give people some time to come in. Thank you to those of you who are very on the dot on time for this one. Right. I can see numbers are still trickling in, but given that it's just past 2 o'clock, I think we might make a start. So hi, good afternoon, everybody, and welcome to our masterclass with the Digitising Social Care team from NHS Transformation Directorate, all about why data standards matter. My name is Katie Thorne, I'm from the Digital Care Hub, and I'm going to sort of run through some housekeeping just on the next slide, and then we'll pass over to our amazing panel of speakers to kind of go through the topic for today's webinar. So if I could grab the next slide then, please. Just some general housekeeping. I'm sure many of you are aware of all of this now. This webinar is being recorded and we will share a recording of the webinar, all of the slides from today's session, and also a transcript of the closed captioning with all of you after this call has finished. All attendees are on mute and we can't see you, I'm afraid. So if you do have any questions at all, please do make sure to pop these into the Q&A area. If you're on a laptop, that will be at the bottom of your screen. If you're on mobile, you'll need to tap the screen and push the 3 dots, and there's sort of a more option, and it says Q&A. Please do use the chat to introduce yourselves, to say where you're from and what you'd like to get out of today. I will be in the chat the whole way through as well, keeping an eye on that. So it's great to hear what people are up to. And with that, I think we'll go on to the next slide then, please. We have a really jam-packed agenda for all of you. So we'll come to Steph Nimmo first, talking about why standardise and what the sort of background is for that. Then Nick is going to take us through what data standards are. And then we're going to get a deep dive from Alison, talking all about standards specifically around digital social care records, electronic care planning systems. And then we'll have Caroline talking about funding opportunities for digital care records towards the end of this session. And Nick's going to do a little bit of a forward view about what's happening over the sort of the next 12 months or so. And then at the end of this, we have at least sort of 25 minutes, half an hour for Q&A. Please do put your questions into the Q&A throughout, and we will make sure that these get asked to the panel. If there's anything that we can't answer today, then we'll make sure to take that away and we can come back to you over email as well. Just to say, this webinar is very much aimed at care providers. I know there are software suppliers who are on the call. We can't answer questions on this specific webinar about sort of the process of assurance for a software company, but I'll pop into the chat the information about who you can contact to have those conversations. So thanks very much, everybody. Really excited for today, and I will pass over to Steph. Thanks, Steph.
Thank you, Katie. Can we go on to the next slide, please? So why standardise? I'm Steph Nimmo. I'm the Comms and Engagement Lead at NHS England's Digitising Social Care programme. And I just wanted to give you a bit of a background and a bit of context because thank you so much for giving up your time this afternoon to come along to listen to us talk about what potentially could be quite a dry topic. Really, you know, when you're considering the day-to-day work that you do as a care provider, coming along to a session and hearing about data standards, how does that relate to what I do? Well, we're hoping this afternoon to give you a bit of an insight into why they do matter and what they actually mean to care providers and the difference that hopefully in the future they will make, so that you can engage more readily in conversations with suppliers and just have a better understanding of where the sector is going in terms of standards. Next slide, please. So I wanted to start off with a bit of a metaphor. So rather than leaping into some of the technical stuff, what do European rail networks and the digital transformation of adult social care have in common? If you press on the return button, whoever's managing the slides, there we are, quite a lot. So I found myself going down a Google hole the other week and found out that there's a program underway across Europe to actually standardize train control systems so that there's safer, faster travel across borders. And what that means is that previously, I remember when I went interrailing, if we travelled from France to Italy, there were delays because they would have to change the wheels on trains. And then, if you've got inconsistent signalling and emergency systems, that could lead to significant risks. So can you just click return again? So as I say, it's not too different from our work. So being able to seamlessly travel across borders quickly, safely, is very similar to the work that we are doing around standards to enable providers to share information seamlessly and reducing the burden of admin. And go to the next slide, please. So there's a bit more about the rail program. It's all about driving interoperability, that word. Which is basically making sure that there's some consistency. And so those trains travel across the different countries. So what are we doing in our work to support digital transformation of adult social care? So now we're in a position where 3 years into our programme, that the majority of the adult social care sector now is using digital social care records. And we know that over 80% of people have access to, have a digital social care record. And so now that we've got so much paper out of the system, there's a real need to ensure that there's some consistency around how that information is recorded and how it can be shared, so that we can get to that point that everyone sort of dreams of having information shared efficiently across different systems, wherever someone is, whether they're in health or adult social care. So that's why data standards and standards generally matter. They ensure this consistency, they reduce this duplication of all the reporting requirements. And it's a fundamental element of being able to achieve that vision of sharing information securely and seamlessly in order to support person-centered care. I'm going to hand over to my colleague, Nick, who's going to tell you a bit more detail now about data standards. We'll go to the next slide, please.
Good afternoon, everyone. I get the interesting topics. I'll try not to bore you to tears in the next 10 minutes about data standards. They are important, as Steph's just alluded to, and it's good to have a general idea of what they are and what they do. But unless you are a assurance specialist or particularly technical, you're probably not going to run into them on a regular basis. Can you just pop to the next slide for me, please? So there's a number of different types of standards that are used. Data standards, rules or guidelines used to ensure data is collected and formatted in the same manner. The systems that many of you will be picking up and using in the DSCR are having data standards applied to them currently in the minimum operational data standard. What that means is information is held in the same way. The example I like to use is if two systems want to talk to each other about someone's date of birth, it's very, very unhelpful if one of those systems is talking in the American language and one of them is talking in the British language and the days and the months are the wrong way around. Because when you start to try and bring information together, both systems will not be happy at what the information is they're receiving. If we want systems to talk in this country, we are going to have to use the British standard, and we'll make sure that it's held in the right format. So it might be day, month, year, hour. It doesn't seem important because you think systems should just be able to deal with that sort of thing, but unfortunately they don't. They're really, really, really pernickety about what you put into them. They're not like people. They can't do inference. You have to tell them exactly what is coming in and coming out. That's especially important in social care, where we've got, as I'm sure you're all aware, if you go to a care plan, two care plans from two providers will not look the same and hold the same information in the same way, despite both of them fulfilling the same function in providing support for a person. Functional standards cover what a process or system should do. So that is, for example, of a high level one, your mobile phone should be able to make calls, send text messages in this way. They don't have to be super detailed and very often aren't. Technical standards govern how computer system or processes work, often being much more detailed. And interoperability standards govern how systems should interact with each other, so what language they speak. There are also overarching standards that can cover how things should work outside of a system. For example, how often a supplier should back up data, or how often you should be carrying out pressure area checks on a person. Those are standards, even if they're referred to as regulations or contractual terms, it still comes back to the fact that they're a standard. Next slide, please. I'll touch on these quickly because Steph's been through some of them already. We've got a lot of benefits when you apply standards. You've got better data quality because everyone is speaking the same language and everyone knows that apple is an apple rather than labeling it a gala or a pink lady. Data interoperability, helping systems to talk to each other. That's important because it means that we can move data easily, but also view data easily. So for any of those that have used GP Connect already, data interoperability has been massively important in making sure that social care providers can see GP information around medication. Improved standardization help because we are reducing unnecessary variation, and where stuff is standardized, it tends to be cheaper to develop, cheaper to produce. And it also helps with improved safety and security. Cybersecurity standards help ensure that we are reducing the risk, because we can't ever remove it, of cyber attacks, and reducing the risk of major impact for the people we look after. Next slide, please. These are going to come around, so I'm not going to go through them in full detail, but just a few of the benefits that are there for yourselves as care providers and others. We verified some of these, and I can absolutely attest to some of these, as I was a care provider myself for 5 years before taking this role in residential and nursing homes. So I've seen this firsthand. We can, through standardization of data, provide the right care with the right information to provide the right care at the right time. Where medication changes happen with a GP, or someone's gone into hospital, you will be able to see, as we go through GP Connect and start to integrate systems more, information in pretty much near real time. So we start to do away with losing the discharge notes and the summary information that's there, or it gets left in the ambulance, and you can see GP records pretty much when you want to be able to alter care plans accordingly. You can see the outcome of hospital appointments and discharge notes, and you can see any other interactions with health, which helps to update what you need to do with the care and support for people. Equally, going back the other way, clinicians, health and adult social care professionals will eventually be able to see other information from social care, including from digital social care records, so they can start to go and look at the information they're allowed to see to support the work that they do without having to go and ask for it. Technology-enabled care and care at home is a major driver for ourselves, for the system, and for the new government. Assistive technology is great, but assistive technology that feeds into other systems and allows information to be taken and used to make decisions that help with proactive care is even better. And we've got wider standards on an NHSC and interoperability community to avoid information being shared twice or more, multiple times across the sector. Whereas if you go to A&E with a person from a care home or from a home care provider, being able to access the information that they need in A&E through the systems they already have is far more efficient and far less time consuming than having to ask family members to remember information or to take all of that with you in paper form, print it out, get in the ambulance and go with people. And then there's other areas that we can link that to later on around voluntary community mental health and other areas that isn't in the initial plans we've got, but may come later on. Next slide, please. I'm going to whiz through these ones. A lot of benefits to other areas as well. DSCR suppliers, it's easier for them to work because they've got less development to do, because we're all going to develop systems down a similar pathway. Department of Health and Social Care and Adult Social Care as a whole will have access to further information as we move forwards, which will allow policy decisions to be better modelled and tested before we bring them out to the sector and look at how we approach them. And eventually CQC will be able to support better information sharing with CQC and reduce the burden that it takes in filling out PIRs and various other bits of information straight into other systems. We'll be able to send information quickly and securely without having to collate it and collect it all together. Next slide, please. And I believe I'm passing over to Alison.
I think you are. That come round pretty quickly. Good afternoon, everybody. Hello, thank you, Nick. So my name's Alison Taylor. I lead up the standards and interoperability work stream of the Digitising Social Care Record. I'm going to try really hard not to use acronyms, so if I do, please drop it in the chat and somebody will fill it in for me, because I am really bad at that. I am a nurse, and I ended up in this area 2.5 years ago, learning about standards, and we all know data matters. So I'm going to try and make it real for you guys as a care provider. And it's really been a lot of learning for me. But it's about the things that you're interested in and why it matters for you. And that's the information sharing and getting and making your life easier without chasing your tail while you're trying to give care. So we really do get it. And this is why I've still continued, I suppose, for the last 3.5 years, plugging away at this standards business. And I'm really pleased that so many of you are so interested. So like Steph said, we've really tried hard not to make it a dry area. And no question is a silly question, because believe me, I still ask silly questions. And I have a lot of clever technical people around me, but I wouldn't class myself as a technician. So let's get on to the next slide, because I haven't got them in front of me. So when Nick was talking about different types of standards, this in a nutshell is a picture, tells you exactly what it says on the tin. A few of them may not, so if you've got questions, please ask. But the top level overarching standards are just basically to make you assured that these systems are doing all that. Because what we want as care providers is to use systems that are safe and secure, and when we're sharing information, not to think about it and just do our jobs. So most of them are self-explanatory. I think the interoperability standards are really important. We've touched on that before, and GP Connect is coming. I'll go into a bit more detail about that, because that's probably the one that most of you may want to hear about. And then the data standards that support that, which are obviously, you probably have all heard of PRSB standards, maybe not. PRSB, oh God, professional records, Katie, something board.
And Professional Records Standards Body.
Thank you. And we work with them closely to make sure that their standards are fit for purpose for social care. And that has led a lot of the mods that I'm going to talk about, the minimum operational data standards. So the dates on there, they're very complex to actually explain unless you're in the world of assurance, but we published back in 23, and all our suppliers are assuring against these standards currently. Some of them are over the line, they're there. Some of them have got a bit more time and working with our colleagues to get them over the line so that they're assured against all these standards, hence remaining on the assured supplier list. And I think that's where we're going next, if I remember rightly. If we can go to the next one. Next one, please. So, Assuring Solutions. Claire Hesse and her team lead up our market assurance team. They're very busy at the moment, hence me presenting these slides. So any questions I can't answer from you, we've certainly got a route to go and ask them. But high level, the suppliers wish to be on the list need to be assessed and assured against all those standards that I showed you on the previous slide. They're all published, and there's a link there when we share the slides that you can go into lots of detail on a page called Confluence, where there's a lot of technicians on there that create standards and put a lot of information on there that actually sometimes isn't written in plain English. So it is very technical and it's very health orientated. It's not a social care website, but it is useful sometimes. We update when there's new standards that are published, and we retain the list with the compliance solutions through the market assurance team. When we do publish a new standard, the suppliers have 15 months to be compliant. So, for example, if we put something on this month, they'd have 15 months, which would take them out to who's good at mental maths. We are in August, about November next year, roughly 15 months. So yeah, they've got some lead time, and obviously that gives them a chance to do development and put it on their own roadmaps, depending on the supplier and what their roadmap is, because they all vary hugely. And currently there's 21 assured suppliers on the list. It's not static. Suppliers are exited from the list if they're not compliant, and that's happened over the past, I want to say, few weeks and months. And obviously this is all monitored by market assurance. So I've just said all that. I think if they don't achieve compliance, they'll be from the list. Remediation is what they're working to now to get over the line. Non-compliant solutions aren't stopped to rebid again. It's a process where you loop the loop. Most solutions do not pass the assurance the first time. It is lessons learned, and you go back and review and build and obviously release to get there. And it's important that providers have regular conversations with their suppliers. That's probably the most important point from my perspective and my learning and my experience. Build a really good relationship with your supplier, understand them, where they're coming from, what they're going to support packages, what their development plans are, aside from maintaining their compliance with standards. I just think that's a really important thing to do. Like in any relationship, when you're working with people, build that. But even more so when you've got somebody contracted to deliver you a service, you really need to ensure that that relationship's quite strong, and you're assured that they're going to deliver to your requirements. Because if they don't, I think everybody's been in a frustrating period where we have to manage contracts and things, and nobody needs that on top of their day-to-day working. So I think that's all we need to say about solutions. Let's move on to next slide. Hope there's nothing else on that. No, good. Do so many of these, you can't remember what order there is. So yeah, just bear with. So minimal operational data standard and GP Connect. Let's have the next slide. So the standard, we've quoted quite a few, but it's quite a trailblazing thing, something that we've done. We've created an information standard notice, which is quite technical to be able to build to a certain level for sharing in a standardized way. And it was released back in April 20. Oh, we are in that same year. We released this year in 24, and it was a real big achievement that sort of like aligns first of type of being able to share a data set between organisations and IT systems. So we are in progress of publishing it on our roadmap for our suppliers. Hopefully by the end of September. We're doing some work at the minute on an assurance tool that is also new and quite transformational, as in we've never done it before, and it's a new automated process rather than it being manual. So it gives us all those benefits of having any system of audit trails and security, and less burden for the teams that are monitoring these things and assuring suppliers against these standards to be able to monitor them long term and it be sustainable, which is what we all want, which is doing it once and sharing it many times. And I think that's all I really need to say about that slide. So we could move on, please. The primary objective, yeah, I think we've talked about that. We've all talked about being consistent and baselining and recording data so that we can share it across, because we all have different care records. We said that, and we all phrase things differently. But certain things, and to go back to Nick's example, date of birth, we all want it shared in the same way, and it is frustrating when we go into systems ourselves personally and fill in dates and you think, oh, this is an American system, because you know the app has asked for your date of birth the other way around. So we're in the UK and we are designing systems for England at the moment. Let's not say UK, I get told off. It's England, because it's different. And that's also part of my learning. So yeah, across England, we want to consistently baseline record that data. And you guys record this every day, the majority of it. That's where I started. It's all based on the activities of daily living and things you do every day. And it forms part of the digital social care record. It is intended for care providers to use and be part of the DSCR, so that it's not any extra burden, and actually it makes your life easier. It provides comprehensive and consistent data structure. And what that simply means is the back end, it's all designed in the same way. It can understand the same language. Apples are apples, pears are pears, as I'm sure lots of people have heard before. The data fields reflect some of the regulatory requirements because it's a really big specification technically. So there's different things that suppliers are asked to do, whether it's a must, a should, a could, or an optional. And obviously that's how we build the structure of data sets and improve them as we go along, because this is a baseline data set. And obviously everything like this needs to be reviewed, improved, and things change in our arena so quickly. The government, for example, we still don't know a lot of the messaging and a lot of what we're working to, but this will still be sustainable and be able to be hopefully interoperable with many systems in the future. And so it's the core information that's needed to deliver and help you improve that care without worrying about what you're recording while you're giving that care. So yeah, next slide, please. GP Connect. So not sure what level of information I need to give here. So if you've got any questions, please ask. GP Connect, what is it? It's a system that shares patient information with appropriate staff so you can deliver better care. The reason I've used patient there instead of resident or individual is because it's a health-driven, I don't want to call it a database system. I think we've all heard of EMIS and TPP. They're the biggest suppliers out there. They are the data controllers. The GP practice holds all the information about you as a patient and everyone else and all our residents. CQC registered providers can now use GP Connect to access a restricted view of the person's record, and I'll talk about that in a minute on the next slide. So to be able to make this live within your care home, within your DSCR, you need to have one of the assured solutions lists, which integrates with GP Connect. Currently there's 6, and in the next few months we're hoping there'll be maybe 12 to 15, and that's obviously on their, or what's it called on the website, the assured solutions list and the listings, so the functionality that they can provide, so you'll be able to see when and where they're assured against that. And you must have the data security protection toolkit, DSPT. You'd think I'd be better saying that, Katie, after all these years. And obviously that is really, really important. And there's information about that out there and free support for providers, because I must give it a plug because it's a brilliant resource that you guys can get through the Better Security, Better Care program to support you to get over the line and give you all the information you need with that. But it's really important. If you want to move to the future of interoperability, that's going to be the key in making sure that you as care providers protect your own way of working and data. So yeah, that's GP Connect. If we move forward, this will give you a pictorial view and a bit better slide to look at, I suppose, than words and just listen to me. It is about people, registered managers. Is the list on there? I don't need to read it out to you, but the most important people that need to access this information to stop them making phone calls or chasing their tail with a pharmacy, or, you know, the everyday issues that you guys come against. And for admissions, allergies, knowing allergies on admission within a few hours, maybe, depends on your practice. Don't think it is sort of like as soon as patient comes through, you're going to have them in your record, because it does take a little while. But, you know, once it's there, it really does improve the communications and the care that you can give somebody. We've got lots of testimonials, I think, next, or is it figures next? Can't remember which way around the slides are. If we can go to the next slide. Oh, it's benefits next. Okay, so nice little picture that tells you literally from a people outcome all the way to the system benefits, because obviously we work at national level here at NHS England. So it's a bit of a top up and bottom down show of the benefits of what we get from GP Connect. Bit of my world really on a picture. So yeah, I'll leave you to read that in your own time, because I think we've talked about a lot of the benefits, and I'm sure you guys will understand that quite a bit. Have the next slide, please. So this is the testimonial slide I was talking about. I knew it was there. They're all from providers that have implemented GP Connect and have recognised time saving for themselves as well as the practice with calling. Quality of care has improved. There's one there about not knowing about a pacemaker, and that was really relevant to the care that they gave the resident. And again, I don't need to read this slide from you. I think you guys will understand totally how improved information gives you power and information to give care that's improved and not second guessing all the time, which is great. Next slide, please. I think that might be numbers next. So yeah, so I've been working on this for quite a good few years now. So back in March 22, we went live with this. And as you can see, we've been improving slowly over the last couple of years. And we've got over 1,600 sites live. I think 80,000 people is quite a big number to have achieved to get their record and help people out there. And nearly 9,000 new staff have come to use this. So a bigger benefit for me with my care home manager hat on was always, well, if you're using something, you're increasing confidence, digital skills, people working but feeling empowered. So there's other softer skills that you get out of people using this and making sure that they feel that it's beneficial to them and not just another thing that they need to do. So yeah, it's really good to see those pictures going up. And maybe they need to be different colours next time. So next slide, please. And I'm going to hand over to my wonderful colleague, Caroline.
Thanks, Alison. I don't know how I follow that. I've only got one slide, so I've not got a lot of time to try and so I'm here very briefly to talk to you about the Adult Social Care Digital Transformation Fund. You may have heard of it. It launched back in 2022 now, so we've been running for a couple of years. Next slide, please. The reason I've come to talk to you about the fund is because the Digital Transformation Fund was created to help care providers move from paper-based systems to digital social care records, and to provide 50% of the year one funding to help you on that journey. The funding can only be spent on the assured solutions providers though, so their systems have to have been assured and as part of the assured solutions list. And as you've just been hearing from Alison and Nick and Steph, suppliers will join the assured solutions list, but they will leave the assured solutions list if their system doesn't comply with new standards that are introduced. And so it's a dynamic list because the providers on it, or the suppliers on it, sorry, will change over time. And we see that as a positive thing because we introduce new standards to raise the bar and raise the expectations on the systems that you're using. And if a supplier doesn't meet that bar, then they're removed from the assured solutions list. Now, we communicate any updates and changes to the assured solutions list as quickly and as timely as we can. And that makes sure that if you are in the process of having a conversation with that supplier, you're thinking of signing a contract and you're thinking about accessing funding, we can tell you as quickly as we possibly can to enable you time to engage with other suppliers, arrange demos of their systems and find an alternative. So the eligibility for funding remains the same. So it can only be spent on assured solutions list providers. we will communicate through integrated care systems and through our websites immediately once suppliers have been removed from the list. If as a care provider you've signed the contract before that date, that is fine, you are still eligible, but from that date forwards, we cannot provide grant funding to that supplier. There are FAQs that we've developed about this that we've shared with all the integrated care systems, and I think we shared with you, Katie, as well. If we haven't, for the Digital Care Hub team, we're happy to do that. So there is some standard comms, and it's not going to be unusual for suppliers to join or to leave the list. As we say, it's a dynamic list. The standards are introduced because we want to continually see suppliers investing in their systems and improving and evolving them to meet the needs of the care sector. The funding, though, is running out, so the clock is ticking. Some integrated care systems have already exhausted the majority of their funding and already have a pipeline of providers waiting. Some have run out and have no money left. Others have limited funds available. The application dates close at the beginning of December, but some ICSs have had to bring that deadline forward because they are running out of funding. It is on a first come, first serve basis. So I'm sure Katie will drop a link into the chat. So if you've got any questions about funding, don't hesitate to reach out and contact your local integrated care system. They'll be able to talk you through eligibility criteria that they might have. They'll be able to direct you and give you some guidance around the assured solutions list, and hopefully put you in contact with other care providers who are already using that system if you want to speak to a peer in your local neighbourhood. That's it from me, Katie. I think I'm handing back over to Nick for the next slide, please, which focuses on where is all this going.
Thanks, Caroline, much appreciated. Can we go to the next slide, please? So before we get into where all this is going, we'll talk about how things are now. We've seen really good rates of digital social care record adoption, which has been a massive help to the sector. The real benefit across social care comes when you start to link some of that digital data together, which is one of the main reasons we need standards. I'll give you a few scenarios about why we're doing this, because that says where all this is going better than any sort of high-level interoperability plan or for future work. Family members consistently want information from a care provider about their loved ones. You don't want to take away that need to speak to people within the care service, but information can be made available to providers, to family members by providers through apps, through DSCRs that will allow them to see information when they want to. That reduces the burden on the care provider because they don't have to spend as much time relaying information to family members that is standardized. Everyone knows and loves the CQC-PIR return that you have to do on an annual basis. I filled in a number of those in my time, along with reporting information to local authorities that is regularly requested. It would be great to be able to automate that and immediately send that information across at the click of a button, having it collated in the way that it needs to be collated in a standardized way, and reduce the burden on registered managers to deliver it. Safeguarding information when you have to collect a variety of information about a person from paper records. Now we have DSCR systems. It would be lovely to be able to automate that and send it securely to safeguarding. I don't want you to think this is just about extracting information from DSCRs and giving it to others. When you're bringing someone into one of your services, being able to see GP records, hospital assessments, their latest care plans available through the local authority would aid massively in being able to decide whether or not that person is suitable for your service and whether you have all of the information you need to be able to take them and provide the care that they need. the majority of the work that we want to do in allowing information to be shared is to put the right information in the hands of the people that need it to support the right care decisions at the right time. All of this information moves currently, but it moves slowly through telephone calls, through emails, or in non-standardized ways. So whilst we're saying what the way of moving the data might be novel, the actual information that we use is the information that's used on a day-to-day basis by all of your services to deliver the care that you need to do. And we want to try and do that, ease that burden on using that information to make it as seamless as possible. Now that seems like it's very far away. However, we've been trialing some of this. It's all very technically feasible, and it's going to be the main focus of the work that we want to do going forward as we move on with the DISC program. We'll leave it there. Next slide, please.
Great. Thank you, Nick. I think that was really helpful. And also, as somebody who's filled in a lot of PIRs in my time, I'm delighted at the thought that some of that burden might come off care providers in the future. We have had quite a few questions through, so maybe if I could ask everybody just to come back on camera briefly, and kind of, they're going to be a bit all over the shop about who they're for, I'm afraid, but I'll do the best that I can. I think the first one, and this kind of came over through email, is if you're a care provider, is there anything that you need to do about data standards, or is it just a matter of having a conversation with your software supplier and making sure they're keeping up with it? And they're not technically expected to do anything, it's said. Don't know. Alison, is that for you maybe?
Sorry, trying to unmute Katie.
Yeah.
I thought quite a few of them were probably for me. So which one is this?
So no, this one came over email, sorry. So I'll start.
Oh, I was reading the questions we've got in the thing.
It's okay. I've got a note of a bunch of them, I'm afraid. So if you're a care provider, do they need to do anything to implement data standards, or is it just a matter of having a conversation with your software supplier and making sure they're having a look?
I think you need to know your requirements of what you want out of a digital system and what you need to know, and that should be your expectation, really. I think doing them, no, but ensuring whatever requirements you have in the system you use is safe and does what it says on the tin for you. That's more important than actually doing anything in the bigger sense. Great.
Okay, thank you. And maybe stick with you. We've got quite a few through on GP Connect, which I'm sure you saw coming. People are always very excited about GP Connect. So first of all, does a GP practice have to give a provider permission to use GP Connect?
Not directly to the provider, but they are the data controller. So yes, they have to give it access to their patient, and they would have got consent. That's all done by your supplier when you sign the National Data Sharing Agreement and go through the process to go live, should we say, with GP Connect in your DSCR. So not directly, but it will be addressed.
Yeah, so it's not something like from an admin point of view that you need to worry about as a care home or home care company, but that is happening in the background.
There is a process, there is some time they'd have to allocate to make it live pre-implementation, which is around data sharing. But apart from that, as long as it's open at the practice, and I should say 97% of care practices nationally are using GP Connect, so they'll be under the consent model for that, and we'll have an opt-out. So if there's an opt-out in place for one of your residents, you wouldn't be able to call that information, as they say, and you'd be informed, but haven't heard of many of them.
Yeah, it's not a huge number of people who've opted out nationally. I think it's about 2% of the whole population, so unlikely to happen. So then we also have final one, oh no, there's going to be more on GP Connect, sorry. Is GP Connect cloud-based?
I just sent somebody else a question on that because it confused me, because all our digital social care record solutions are cloud-based that have GP Connect. So I'm not technically able to answer it straight away. In my head, and my gut reaction is yes, but it's on an NHS infrastructure, which is why I've got reservations. Nick, come in.
GP Connect does link to cloud-based services, but some of the NHS England architecture systems you need to link to around identifying patients were not developed specifically for cloud-based services. So you would also have to go through some cybersecurity work, let's put it as work, that will need to be done as if your system was not cloud-based, simply to link with the NHSE systems. Now, NHSE systems are generally updated. Eventually, that may change, but you've got extra work to do to link to GP Connect currently.
But as a provider, you haven't. Your
But
supply
as a provider, you do
bit
not.
of work, so you haven't actually got anything to do. It's more of a supplier and a technical piece of work.
Thank you both. That's really helpful. I think what we will also do is, so there is a specific web page. I haven't popped it in the chat yet, so we'll find it later. All around GP Connect, which also has some of the technical specifications. So we'll make sure that gets shared with everybody, sort of along with the slides and the recording after this call, if anybody wants to dive into some of the technical details behind that, which I have to admit are somewhat over my head. So I know you did answer this one in the chat, Alison, but just to make sure in case anybody hasn't had a look at that. So there was a question on, is there a way to be notified when new standards are published on the DSCR roadmap?
So yeah, if you go into the link, you'll get a page up called Confluence, and you probably have to join it with an email address and a password to then give yourself alerts, basically. And be careful what you wish for, and be careful what you do with notifications. But that is the only way to do it, and then you'll get email alerts when things change. And it's a public site, so everybody gets access to everything that's happening.
Brilliant. Thanks, Alison. And I guess just as a reminder, I know you did mention it during the webinar, that if you're a care provider who's looking for a solution for the first time or looking to switch solutions, on the issued solution list, it's always kept updated with which standard software companies are compliant with currently. So you don't have to go looking at the Confluence thing. If you just look at their listing on the issued solutions list, that'll be up to date for you.
Only go into Confluence if you want to know detailed technical standard stuff, really. Stay away from it otherwise.
Exactly. So then, Caroline, question for you. We've got, how do organisations apply for the Adult Social Care Digital Transformation Fund?
Yeah, so super. So if you go to our website, so digitizingsocialcare.co.uk, you will be able to find the funding pages. They're on the home page for the website. Just a reminder, each integrated care system has slightly different eligibility criteria based on how much money they have left to grant. This is a fund that is now coming to a close. So to find out more, follow the link that Katie's just very kindly popped into the chat. I would really encourage you, if you've not already gone digital and you are still using a paper-based system, so you've not gone digital yet, get in contact with your local integrated care system sooner rather than later. They all have different deadlines for closing applications, the very latest being the beginning of December. A reminder as well that we can't fund care providers to move from one system to another. So the key eligibility criteria is you need to be moving from paper to digital to be able to access this support.
Thanks, Caroline. And then one for Nick. Nick, could you share a timeline for the data standards that you're talking about?
So technically one for Alison here, as well as we have a data standards roadmap. The only data standard that we have live that's on there currently that's being implemented outside of The normal assurance process is the MODS, minimum operational data standard, and that I believe was 13 months left.
No, we're just in the process of updating because we're doing the assurance tool. So the end of this month, beginning of next, there might be some updates. But by the end of September, we should have published mods on the roadmap. And currently, we haven't got anything else planned at the moment.
Yeah. So I suggest looking at Confluence, as Alison's already alluded to find out what that roadmap will be and when new data standards will be released.
Thanks both. And I also have just put a link into the chat to the newsletter sign up for the Digitising Social Care team. Is it, Steph, am I right? It's a monthly newsletter that you put out.
Yeah, that comes out monthly. So a copy went out yesterday. If anyone is not registered and wants this month's copy, if you just send your details to Katie and I can collate them and get you that. But yeah, just register for the newsletter. Also follow our social media channels and our website, and we publish all of our information through those links.
Yeah, exactly. So if anybody is on here going like, oh gosh, I don't want to have to check web pages every day, the newsletter is definitely going to be your best bet for any updates on the minimum operational data standard, the funding that Caroline has mentioned, and many of the other topics that we talked about today. So we then have, I think it's more of a comment from Sue, and I don't know if anybody of the panel would like to talk about this. So Sue's provided nursing clinical negligence reports as an expert witness for over 25 years, and often finds that they're frustrated by the documentation sent from defendants using digital care systems. Perhaps more thought could be given as to how the information is presented in such systems in relation to defending a claim. Some of this possibly is related to poor staff training or use of the system, or how the information is shared. But often it's how the care plans related documentation is laid out. Is this something that the minimum operational data set and data standards is going to help with, do you feel, in terms of standardizing information?
I would say yes, I agree. And there's not an awful lot at this time we can do about that, but the future thinking could always do that. At the moment, it's very for the care provider and for the care planning, and that is important to support litigation. I absolutely hear you. But at the moment, there's no, I don't know any plans to link in with people like HMRC, which would be amazing. And the coroner's office and places like that going digital, being blue sky thinking in however many years' time. But at the moment, this programme won't address that particular issue. Training is always ongoing and improving stuff is always ongoing for how we collect data and what we put, but it is collected by care staff, care managers, registered managers and clinicians. So there's a varied wide training need that we've had for many years across social care around record keeping, is probably the phrase in social care that I recognise. So yeah, I hear you and I hear your frustrations, but at the moment our programme doesn't address that specific issue.
Well, thanks, Alison, really helpful. We do have a question here about once the funding for the DSCR is finished, what will be next digital transformation work streams will be funded. I'm going to take this one off the panel just to say that obviously there's been an election recently, and so we are waiting, I believe, I can see some nods and some smiling from the team for direction from the new government about this. So it's not that we're trying to be cagey, we're just sort of waiting to find out exactly what that looks like. As I said, please do sign up for the newsletter. As soon as we know, we'll be doing a webinar and putting information out there. So sorry, we can't be more specific at this time on that one. We also have a question I'm going to assume is about digital social care records, where we had they want to know who can enter information into a digital social care record. Is it only doctors or carers and family members as well? I don't know who would like to take that.
I think I just address that with at care home level, it's who they decide. But most of the systems can allow a role-based access control. So at the moment, it would be carers, it would be senior carers, team leaders, anyone, as I say, in a care home environment. When I had a digital system, the housekeepers, the handyman, maintenance man, whatever you want to call them, everybody that worked there had a reason to be on the system. So yeah, that's how it works. So yeah, you can give any member of staff access.
Well, thank you, Alison. And just from my experience when I worked in a nursing home, and quite a lot of these systems now also have family portals. So
Oh, yeah.
care and care workers, nurses, people who work in a care home or home care setting can obviously enter information into the record, but that information can also be seen with consent, obviously, and permissions in place by family and loved ones, if that's something that the individual would like to have shared with their family or loved ones. If we're talking specifically about GP Connect, we're looking at, from a social care perspective, it's view only at the moment. So the GP is responsible for inputting information into the GP record. You can see portions of that with GP Connect within your digital care record solution.
Can I just pick up on the family portal stuff as well, Katie?
Yeah.
We did quite a lot of work around this, and we spoke to a few registered managers, and they said when they offer family portal access out to families, it really improves that relationship with the families. It reduces the anxiety, the phone calls. They found that the care plans where the family portals are actively used are the best ones. And then something that is really important not to forget is the person at the centre of it all. If they have capacity, they can also input to their own care plan and make sure it's absolutely personalised. And I think those sort of things are really important to bear in mind when you're thinking about, you know, CQC inspections, but more importantly, delivering, you know, person-centred care.
Brilliant. Thank you, Steph. That's really helpful. I'm also trying to find, so about 2 or 3 weeks back now, we actually worked with Devon, ICS and IceCreate, who've done some work looking really specifically at the benefits for clients and for families and being able to access their own data. Once I've tracked that down, it's on our YouTube channel. I will share a link to that recording as well, because I think they just had such amazing feedback and testimonies from people being able to access their own information. Great. One as well from much earlier on this call, which I completely missed, and I'm sorry about that. And I've not written down the name of the person who asked it. I'm really sorry. But how do standards work in supported living situations? I know we talked about care homes, home care, but if you're from supported living, will these also impact you?
Exactly the same.
Mm-hmm.
No difference. The only thing that's probably not, but they're not from a standards, because we know the other end, the ways of working are completely different, but systems wise and entering data, definitely home care is considered as much as care homes, and it's not perfect, but definitely everybody.
Thanks, Alison. It's reassuring to hear. And somebody who has clearly been on the Assured Solutions list recently and has noticed there's a tab for list price, but there isn't information in there yet. My understanding is that we're not quite sure of the timeline yet of when pricing information will be listed. Is that correct? Okay. Hopefully soon is the answer, but I can't give you a specific date, unfortunately. But I think that is all of the questions that we have received so far. Please do continue to get in touch with us at hello@digitalcarehub.co.uk if you do have any following questions. If you just pop onto the last slide, I want to do one final plug for the Clock is Ticking campaign and for funding. Oh, Alison, sorry.
The old hand up, sorry.
Yeah, thanks, Alison. I saw you waving.
I've just sent you a message because I didn't know where to put it because we're on Zoom. I've just had a response from the guys around the cloud-based stuff, so I thought somebody asking that's probably more technical than everybody else, so you might want to share it after. I didn't know how to share it, but I've put the information to you. Oh, there you go.
Brilliant. I've popped it into the chat for everybody, but I've also copied that and we'll put a link in the email that Brianna, who will probably be emailing everybody afterwards with a link to the recording and the slides, will do that.
And some of it doesn't make sense to me either, so please come back with questions if you've got any and we can get them answered.
Exactly. Thanks, Alison. Really helpful. Great. So do make sure to look into funding solutions if you are eligible for funding and haven't done so yet. It's great that we are actually getting funding into the sector for all of these things, and lots of organisations have already taken it up, which has been amazing. So do make sure you don't miss out on that. Then I think all that's left to say is a huge thank you to the panel. I know we've had to reschedule this one a couple of times, and it's a lot of information that you're getting across, but you've done that amazingly. Thank you for answering all of these questions. And we will see you all again very, very soon. Thanks very much. Goodbye, everybody.